Good morning, Miramar, and welcome to the show. I'm your host, Tamara G. Don't forget, check us out on all of our social media. We're on Facebook, Twitter, and Instagram at City of Miramar. We all know that it's right here in Miramar, but just to the south of us, our lovely neighbors in the city of Miami Gardens, they have something that is going to be going on, and they're inviting all of us, everyone who is here, watching today, to join. We have with us Tamara LaBruce. She is the program director for Live Healthy Miami Gardens. And with her is Dr. Jody Grace, an assistant professor of psychology at St. Thomas University. And she also serves on the host council, that is, for the Live Healthy Miami Gardens. Well, look at you, Dr. Grace. You're lucky enough to be with two Tamaras, aren't you?
I know, I love it.
And we are happy to have you guys here. So let's start with Tamara, talking about Live Healthy Miami Gardens. I have actually been lucky enough to host two of these forums that you guys are having, but man, you guys are doing some great work to make everybody healthy, not just in Miami Gardens, but everybody.
Yes, absolutely. And thank you so much, Tamara. It's always such a pleasure to see you and to spend some time talking with you. So yes, Live Healthy Miami Gardens is kicking off its Take Your Loved One to the Doctor campaign. This is one of many different initiatives that we have within Miami Gardens, focusing on health and wellness. So just as a little bit of background, Live Healthy Miami Gardens was started in 2014 through a 6-year grant by the Health Foundation of South Florida. We're now currently, and have been for the past 4 years, funded by the CDC primarily. And the initiative is really focused on looking at health indicators and improving, health disparities within the city of Miami Gardens. And we focus on 5 different health impact areas: alcohol, tobacco, and other drugs, nutrition, physical activity, mental health, and primary health care. And we have a number of different projects under those 5 health impact areas. And Take Your Loved One to the Doctor is something that we do on a yearly basis. It's a month-long campaign. And Dr. Grace, who have been a partner with our work with the with St. Thomas University, have been a partner with us since the beginning. And so they're one of several partners that help to get the message out of how important it is to go to the doctor.
Well, I'm so glad you brought that up. And Dr. Grace, being an assistant professor of psychology, there is a certain psychology about taking your loved one to the doctor. Either people are all in, let's go, let's get it done, or there are people that I'm sure haven't been to the doctor in decades, not even years, decades.
Right.
What's the psychology behind it, and how can we get more people to participate?
You actually said it perfectly. So, we encounter those people who never miss an appointment, right? Mm-hmm. And then we also encounter people that haven't been in years. You said it perfectly. But I think that's one beautiful thing about this campaign. We learned in Miami Gardens that there were people who were so conscientious about going to their doctor's appointments. And so one great thing about taking your loved one to the doctor is that we're reaching out to those people and asking them to think in their life of the person who I like to call them the reluctant patients. Mm-hmm. The people who don't always go, they put it off. I've been one of those. And of course, we study the things that affect us in our personal lives. So it comes from my own family experiences and my dad not getting to the doctor when he should, right? So in thinking about that, I immediately can name family members who I know would benefit from getting to the doctor. So we want to ask the people who are so good about going, that's great. You're taking care of yourself, but now think of those neighbors, coworkers, right? And let's try to get them to the doctor. In terms of psychology, there's so much, Tamara. But one thing that we learned that is in the national data, but also in the local data, when we asked questions of people in Miami Gardens specifically, we found out that if your family, your loved ones, your friends and family thought that it was important for you to go to the doctor for a yearly checkup, those people reported they were more likely to go. So we know it matters. We know it gets people to the doctor, right?
Right.
And there's so many reasons people don't go. We could give you a laundry list: access, transportation. But there's also some interesting things. Believe it or not, people who haven't gone to the doctor in a while they feel bad sometimes about it. When they go, they feel guilty that they haven't been in a while. So that is another reason. There's so many. You probably should cut me off because I could talk all day about it.
Well, it's funny that you mentioned about, so many different reasons besides the transportation, besides money, which we'll get to that in a little bit, that I'm sure it deals with the inequity, health inequities. But a lot of people, and I can tell you this, my grandmother was one. If it
Mhm.
ain't broke, don't fix it. And she just would not
Yes.
go to the doctor unless she wasn't feeling well. But I'm thinking to
Mhm.
myself, okay, and again, a different time, 20, 30 years ago, people weren't so health conscious, and particularly in her age group. But we found out that she had cancer, breast
Mhm.
cancer. Luckily, everything was good and she survived it. But because it wasn't hurting her. The lump was there, but it wasn't hurting.
Yes.
It wasn't until it started hurting that
Right.
we found out. She told us and we took her to the doctor. So how do you get over that mindset?
Mhm.
So great, Tamara. If I could say this, I have that experience in my family as well with an aunt who worked very hard, as we all do, and she was tired. She knew she was tired, bone tired. And she didn't get checked up. She didn't get it checked on. And it wasn't until she was taking a shower one day and felt something in her stomach that she did go get it checked out. But fatigue is a symptom, and unfortunately, it was too late for her. She had cancer and it started as ovarian and moved to her stomach. But she had said she had been really tired, but she attributed it to how hard she was working and getting older. And oftentimes we see if there's a specific symptom, people are a little better about going. Now, they still may put it off a little bit, but when they just feel tired, and we know our bodies,
Mhm.
the more you attribute your fatigue or not feeling right to, well, I work so hard or I'm getting older, that contributes to delay. So don't ignore that. If you feel tired, we are getting older, but you know your body, right? And I know that it can feel scary to go in, but there's so much that we can do. And my dad's experiences, he had a terrible time at age 47. His birthday's coming up, he's going to be 75,
Awesome.
right? That's because of medical science and getting to the doctor. So, there's so much that we can do. But I think you could come teach my health psychology class. You're saying all of the things, these things.
These are just all
So
my family members, trust me, Dr. Grace. Now, Tamara, we've been talking about the older relatives, the moms and the dads of us, because we are in that age where we're starting to take care of our parents. But what about the parents who have younger kids that don't go to the doctor, or there's that age group, those 20 to 30-year-olds, you're out partying every weekend, and yes, you look great now. I mean, all your muscles are out there, you're looking great, but who knows what's going on the inside, right?
Yeah, absolutely. I agree. And this campaign doesn't target any one specific age group because we all need to be going to the doctor. And more, we're seeing younger and younger people, developing, cancer and other life-threatening diseases. We don't know, what contributes to that necessarily. We don't know if it's our diet or environment or a combination of different issues, but we're seeing a lot more of that. In fact, I had a dear friend who passed away just this year, and she was 42 years old, and she passed away from cancer. So it's not really targeting any specific age group. The idea is to remember that that primary healthcare checkup is really the gateway to good health. You need to have a relationship with a doctor, with a medical provider. You need to know what's going on with your body. And no matter how good you feel, how active you are, how well you eat, those are not substitutes for going to the doctor. It's really about a full, comprehensive kind of approach, to good health, and going to the doctor is part of the total package in terms of how you should be taking care of yourself. So we're encouraging everyone to go to the doctor, no matter how young you are, no matter how great you feel. We had one of our colleagues who tells a story, and you probably heard the story last year because she shares the story all the time. And she was diagnosed with diabetes, just 2 years ago as a result of just going to the doctor. She had no symptoms, was feeling really good on a regular basis, didn't have any reasons to be concerned. And yet she was walking around, with dangerous levels,
Right.
of glucose. And so you never know what's happening in your body. And so we just want everyone to go and get that checkup and encourage the person that, the people in your life that you love to also do the same.
If you are just tuning in to Good Morning Miramar, welcome to the show. We're speaking today with Tamara LaBruce. She is the program director for Live Healthy Miami Gardens, our sister city right next to us. And we also have Dr. Jody Grace, assistant professor of psychology at St. Thomas University. She also serves on the host council for Live Healthy Miami Gardens. Have a great event coming up on October 25th. It's a Tuesday evening, 6 p.m. via Zoom, because everybody can watch it from home and can participate. I've actually hosted 2 of them for you, and I'm very pleased and happy to be hosting this one coming up on October 25th. Tell us a little bit about it, Tamara, and how people can get involved.
Yeah, so there's a number of different events that are scheduled, and we'll talk a little bit about that. But the event that you're talking about specifically is, we're really excited about it. It is our Health Empowerment Virtual Summit. We did this last year and it was a huge success. And so we decided to repeat it. And so the summit really features interactive, community health conversations, healthcare provider information, empowerment segment. We have some performances, and it's an educational component, right? So it's bringing the community together to have a conversation about the importance of this campaign, the importance of this, idea of going to the doctor and getting your checkup and knowing what's going on with your body. So, so that event is going to be from 6 to 8:30, and it's just a fun, interactive way, to bring the community together to talk about a really important topic.
Yeah, it was amazing, the people that you all had on, the experts last year, as well as, I mean, you gave away prizes, like you said, there was entertainment. It was a lot of fun, and people really got involved. Like the chat was steady going, people having questions, wanting to ask the experts. And I want to ask our expert here, Dr. Grace, that now we're coming out of this COVID thing. People were shut down for 2 years, 2.5 years for the most part. And we are now starting to venture out a little more. Well, some of us are. There are still some people that are, not really comfortable being out in public anymore. So how do we get around that and dealing with the health part of that as well? Because that may be a reason too why people haven't gone to the doctor. They just don't want to be out amongst other people.
Yeah, that's a great question. Early in the COVID days, right, in the beginning of it, we really were seeing in some of the national data that it was keeping people away. And even in terms of not getting emergency care, right? So they were even delaying chest pains, things like that. I am hoping that people are now getting back in the habit, and it really is a habit, right? We were talking about young adults earlier, getting in that habit of going in to see your primary care physician. So I think that I hope people are getting back to it. If they really don't feel comfortable getting out, I know there are great telehealth options where they can have meetings with their doctors. And, I really think of the patient medical practitioner relationship as a partnership. And Tamara was referring to that as well. So you need that meeting time. And I if I can give a plug for the Health Empowerment Summit, I talk about how to get the most out of those doctor's appointments, whether it's telehealth or in person. How do you have your questions answered? Well, the best thing to do is write them down ahead of time, whether it's telehealth or in person. Think of all those questions that you have. So we're going to be talking about how to get your questions answered. Back to the COVID question, it's complicated, isn't it? I do think that people need to continue to engage in good preventive healthcare behaviors. I know that people have COVID fatigue. We've talked about that in terms of a new normal campaign, right? That we're not done with COVID, but we are in this kind of new normal.
But you would think so, Dr. Grace, because I was traveling this past week. I've never stopped traveling. I was on planes and everything, but I always wear my mask. Even in airports, I wear my mask. The only time my mask is down is if I'm eating. That is it. Well,
Yes.
I probably was the only one that was wearing a mask, or that, and I say
Yeah.
that facetiously. If there were 300 people on the plane, it may have been 10 of us, and I'm not playing.
Mhm.
Everybody else is just going la-di-da-di-da, like life is back to normal. And I don't know if it's ever going to get back to normal, much less, be like it was
Right.
before 2020.
Yeah.
Yeah, so I think that those
Definitely.
good preventive health behaviors, I agree with you, but we need to be thinking, and I think Miami Gardens is great about this, and I'm sure Miramar as well, that it's not just about us. So the mask is about community health. This campaign is about community health. So we should be thinking of everyone, because we often don't know if the person that we're interacting with has immunosuppression, right? Is going through a cancer treatment. And so I like to think and talk to my students about, yes, maybe you're feeling healthy, right? And maybe you're feeling okay, but wearing the mask and practicing good hygiene and getting your checkups is about community health, right? It's about protecting everyone. And so, but I do hope that people will still make those doctor's appointments if they really feel uncomfortable or feel that they have immunosuppression. Then perhaps they are doing telehealth. But I think it's important that we do make it to our appointments, and we have some great opportunities this month for people to get to the doctor.
Well,
Yeah.
let's talk about that. Tamara, go ahead.
Sure. I just wanted to add to what Dr. Grace have said, that this idea of, if you're not comfortable going into the doctor and requesting a virtual visit, is definitely something we can accommodate. Because the whole idea with this campaign is really like removing all of the barriers, that folks may experience in terms of getting to the doctor, right? So if you don't want to go in person and you want a virtual visit, we can make that happen. If there's a money issue or a lack of insurance issue, we're addressing that, and we're working with these amazing partners, who are there to provide these services at no cost. So the series of screenings and community events that we have scheduled, are really meant to just remove all of those barriers, so that there is no reason, there's no excuse, there's no barrier, there's no challenge, to you getting to the doctor. And so we've been lucky enough. Live Healthy Miami Gardens is a collective impact initiative, which means that there's a whole bunch of folks coming together, under this unified vision to improve health conditions in Miami Gardens. We're working with about 68 organizations, and several of them are partnering with us, on this campaign. And I wanted to just send a little bit of a shout out to them, because we couldn't do this work without them. Obviously, without the funding from the CDC, we couldn't do this work. But also, in addition to the CDC, Center for Child and Family Enrichment, Jesse Trice Community Health System, UHI Community Care Clinic, Universal Medical Clinic, and Trinity Church, and of course St. Thomas University are all working with us, to execute this campaign. So we brought all of the right folks together, all of the major players right here in our community, to support you and to be there to serve you and to provide the services that you need. So there's no reason, and no challenge and no barrier that hasn't been thought about and that have not been addressed to make it easy for everybody to get to the doctor and get these screenings.
And what screenings are involved in that, Tamara?
Dr. Grace?
Oh, sure. I was like, "Ooh, I'm ready."
Okay.
So
She loves
Tamara
this
knows
part.
me. She knows me. So Center for Family and Child Enrichment is our first screening day, and that is coming up next Tuesday, 1 week, Tuesday the 18th. That's October 18th. And that day, it's from 10:30 to 7 p.m. So great long day, right? With lots of hours for people with different work schedules. They are doing dental screenings. The highest rates of medical delay and avoidance are for dental care, Tamara. So, you can go and get a dental cleaning. You can get an oral health screening there that day. You can get a mental health screening that day. And the provider there who does the mental health screenings is awesome. I know him. You can get, listen to this, you can get a free, I never see this, a free pelvic exam, pap smear, to test for cervical cancer, right? A cervical screening at CFCE, Center for Family and Child Enrichment, on that day. Now they're going to do appointments for that. There's 10 appointments. And I want every 10 of those, I want them all filled, right? Because that's such an opportunity. They're also doing, it's important, they're doing COVID vaccines and boosters, if you haven't had your booster, right? And they're also doing flu shots. If you get a COVID vaccine or booster or flu shot, they're offering a $25 Walmart or Target gift card if you come in. Now, those are limited, right? Limited availability, but you can come in and get paid to get your flu shot. And
it sounds like a plan for me.
Right? Flu shot.
Unfortunately, I'm already boosted, but.
But for the flu shot, October is the time to get it. They recommend October for the flu shot. And then they're doing, diabetes screening, blood pressure screening, sort of adult wellness checks. So, that's Tuesday. What a great day, 10:30 to 7 p.m. at Center for Family and Child Enrichment. The next screening day, there's 3 screening days next week. The next one is Friday, October 21st at Jesse Trice Community Health System. And at Jesse Trice, they have so many dental opportunities. And as Tamara had said, they're offering a teledentistry visit. So, for example, if you don't want to get out, Jesse Trice on Friday, October 21st is offering it through teledentistry, or you can go in person and get a cleaning or an oral health screening. They will have a great setup for you for that. They are also doing mental health screenings. These are free, right? Absolutely free. They're the only facility that's also doing HIV screenings and STI screenings, PrEP screenings. So that their location is the only one doing that. They are also doing flu shots. They are the only one, and COVID vaccines and boosters. They also have the monkeypox vaccine. They're the only of the 4 sites doing the monkeypox vaccine, if you're interested in that. And they're doing all of the, blood pressure, diabetes, cholesterol checks. They're doing all of those screenings as well. And if you fall between the ages of 50 to 64, if you're a woman between the ages of 50 to 64,
what's wrong now? What's wrong now?
This is specific. If you're between 50 and 64, a woman and uninsured, so this is a very specific category, you can get a referral for a mammogram, right? So that's important. Yes, so that's good. You could get a referral for it. And that's specific, 50 to 64 women uninsured. But now all the other things are for anybody, okay? For anybody who wants to do this. Then we have 2 more screening days that are Saturdays. Saturday, October 22nd, the last 2 Saturdays of the month, Saturday, October 29th. The 22nd is at UMC, Universal Medical Clinic. Now they're doing kind of your basic screenings, blood pressure, diabetes, cholesterol check. And they have free food. So let me put that out there. They're the clinic that's saying we have free food that day. And they're doing it on Saturday, the 22nd, from 10 a.m. to 5 p.m. Mm-hmm. And then the last Saturday of the month, the 29th, is UHI Community Care Clinic from 10 a.m. to 4 p.m. They're also doing the basic screenings, diabetes, blood pressure, adult screenings. They also, though, have flu shots. So it's a good chance if you hadn't gotten your flu shot. And if you get your flu shot and you're the first 30 people to get a flu shot there, you get a $25 Amazon gift card.
Wow, that's on October 29th. So you guys have covered all the bases, Dr. Grace. This is amazing. October 18th, 21st, 22nd, and 29th. We're going to give the website where people can find all this information, because truly all of it is free. That's the best part about it. And if you cannot afford it, then this would be a great time to come in. And dental is amazing. I love the fact that mental health is included as well. It's not just your blood pressure and your diabetes. It is you guys are doing the whole program. So thank you for that. And give us the website, Tamara, where people can find out, because lots of information there. Again, the dates are October 18th, 21st, 22nd, and 29th. But how can they find out where to go to where they want to go specifically?
Yes, I know that everything that Dr. Grace covered, it's a lot, and everyone obviously didn't catch all of that, but we have all of this information listed for you on our website. So anyone who's interested can go to livehealthymiamigardens.com. So that's www.livehealthymiamigardens.com, and all of the information on the campaign is there. The information related to the different screenings, the dates, the different locations are also there. But also remember that this is a campaign where we're asking people to actually take the pledge, right? So don't just go to the screening event, actually take the pledge. It's a call of action. And we want to build some momentum around this. We want to build, a real community conversation and a real campaign around this idea. So we're also asking people to not just visit the website to get the information in the screening, but to also, take the pledge. And folks can take the pledge by texting the word doctor to 545454, and Dr. Grace is holding that up so you can see. And there's also an opportunity for you, if you're on social media, to also use the pledge graphic and to push this message out there, using your own platform as well. So we're wanting as many people as possible to take that pledge. Encourage the people that you love to also take the pledge as a way of supporting the campaign, getting behind it, and creating a unified voice, if you will, around this idea of how important it is to go to the doctor.
I love it. And again, all the information, livehealthymiamigardens.com. They want bring a friend, bring a family member, bring as many as you like, because we want everybody to get screened. There is a question. Is this open to just Miami Gardens residents, or is it open to anyone?
No, obviously our primary focus is Miami Gardens, because we're Miami Gardens, City of Miami Gardens initiative. But this idea is something that came out of a national initiative, and so we're just mirroring this at the local level. But we want to push this message, as wide as possible. And so it's open to anyone who is listening, anyone who haven't gone to the doctor, and anyone who wants to go to the doctor, and anyone can take the pledge. So it's really open to the whole community.
Love it. And the residents of Miramar love it too. Don't be surprised when you see some of your neighbors there.
We would love to see you.
October 18th, 21st, 22nd, and 29th, because you guys are doing some amazing work. So thank you so much, Tamara LaBruce. She is the program director for Live Healthy Miami Gardens. Also, Dr. Jody Grace, assistant professor of psychology at St. Thomas University. She also serves on the host council for Live Healthy Miami Gardens. For information on any of these screenings and how you can get involved, as well as on October 25th to be on the Zoom from 6 to 8:30 p.m., you can go to livehealthymiamigardens.com. livehealthymiamigardens.com. Thank you so much, Tamara. Thank you so much, Dr. Grace. I look forward to seeing you guys on October 25th, hosting that event, and all the people that are going to be coming out on October 18th, 21st, 22nd, and 29th. Much success for all of you.
Thank you so much, Tamara. Thank you for having us.
Thank you.
Thank you. And thank you for watching Good Morning Miramar. Until next time, I'm Tamara G. See you.